Thank you. Thank you. Thank you. I want to extend my welcome to each and every one of you. And thank you so much for your time and your generosity and your care and your concern. As introduced, I'm Dr. Peter McCullough. I'm an internist, a cardiologist. I'm also a trained epidemiologist. I trained in epidemiology at the University of Michigan. I'm currently in academic practice in Dallas, Texas. And as so many of you, I have really thrown my entire clinical and academic career right into the path of SARS-CoV-2, COVID-19 for a reason. And I recognized early that this was going to be the medical challenge of our clinical and academic careers. And I did not want to be on the sideline. I was not going to be one of those that was going to watch others in this epic battle. And it's a battle certainly of mankind versus the virus, but I think in many ways it's a battle of good versus evil. And I told Tucker Carlson that when I came off set, I said, you know what, this is mano e viro, and it's also has this very a dark versus very light contrast that we have in COVID-19. The theme of this symposium is has three major parts to it. One deals with childhood vaccination, which I think is really the public health issue on the table right now. The second has to do with natural immunity and where we are, what our understanding is, and how natural immunity can be a link to us breaking this grip of fear. And then lastly, about medical therapy and how important it is in our path through it. So let's take up childhood vaccination. I just have a few comments to add to what Dr. Alexander said. Dr. Malone gave you the molecular basis for both vaccine and natural immunity and how robust natural immunity can be. We have tens of millions of children in the United States. The estimate is the majority of them have actually had COVID-19. Thank goodness. They've already been through it. Most parents have missed it because it was a drippy nose. It was so mild that the children, in a sense, have been spared from this plague. And this is absolutely a real blessing. Importantly, there are now two analyses I think everyone should be aware of. One is by Tracy Hogue from the University of California at Davis. It was published in late August, where she used the VAERS and VSafe data. And she analyzed reports of myocarditis. This is heart inflammation. I told you I'm a cardiologist. I've seen this. I know exactly what I'm talking about here. The vaccine has the ability to seed cells in the heart with lipid nanoparticles. We believe the cell line is called pericytes. They are around blood vessels and they support cardiomyocytes, the main contractile cells in the heart. And it's now known that the vaccine itself, from preclinical and clinical observations, causes myocarditis. It's not a conjecture. The vaccines cause myocarditis, particularly Pfizer and Moderna. And I anticipate with enough data, enough exposure, it'll also be with J&J, AstraZeneca, and the other vaccines available. What does this mean? This means, although it's rare, that in fact it can happen. What Tracy Hogue showed is with VAERS and VSafe, it's more likely for a child to be hospitalized with myocarditis than taking your chance with COVID-19 and having the rare circumstance that a child gets hospitalized with COVID-19. And it doesn't assume anything with respect to treatment. So if we had a child who developed COVID-19 with some mild treatments, some easy to administer treatments, those with severe symptoms can be spared the hospitalization. So the Hogue analysis was heard on 2 occasions in September and October by the US FDA, by presenters that in a sense are on our team, among individuals in this room and closely aligned. So what I'm telling you is our experts know this. Our CDC and FDA know this. They know that children, your grandchildren are more likely to be harmed with the vaccines than they are to be helped in terms of being spared COVID-19 hospitalization and death. Second major analysis, Ron Kostoff et al. published in Toxicology Reports. The title of the paper, Why Are We Vaccinating Children for COVID-19? His analysis dealt with mortality. And across every age group, an individual who took the vaccine, more prominently in the older age groups, was more likely to die after the vaccine than actually take your chances with COVID and ultimately die of COVID. These two important trade-off analyses were both, again, presented and heard by the FDA on 2 occasions. Now, I've been on national TV, a frequent contributor to Fox, and I've told America on multiple occasions, I think our federal agencies are running about 9 months behind on interpreting the data. Most of what's coming out and most of what we're sharing with you is late-breaking information in preprint format. I'm an editor of a major journal. I deal with this every day. I can tell you from the time we fully form a manuscript to the time it gets through all of its adjudication and publication can be up to 2 years. Believe it or not. We don't have 2 years of time. We don't have 2 weeks of time. We are responding to brief reports, preprints. We're rapidly integrating information in order to best apply our skills to helping the population get through this difficult time. This is a time for expert analysis. This is a time for teamwork. We need multiple individuals from multiple different specialties coming together. America should be seeing teams of doctors on TV, giving advice, working together. We've had White House Task Force 1, White House Task Force 2, and we pretty much have seen little or none of them. We have one person on TV where we see that person's picture in the frame, and I said it, probably the most inflammatory thing I've said on Fox News is we have a medical dictator that we're looking at on TV, and I can tell you this is something that is not healthy for America. In fact, this process of seeing one person without a range of opinions, without any debate, without any identification of stakeholders and driving consensus, the fundamental processes that we make fair decisions in our country, this process of seeing a medical dictator itself is a disease. It is a disease on us right now. We are diseased from a public health perspective. We are diseased. There is a process. It is a disease. There's the virus that's the disease, but there is a mass psychosis, and it's spreading from mind to mind to mind to mind. And the head of that disease, the head of that pestilence that we have right now is our public health agencies. And it's sad to say that, but it is true. And I can tell you, I was asked to present for the Heritage Foundation in Washington, which is a key group of think tank leaders for a variety of congressional oversight panels, Senate committees, and to the Department of Health and Human Services, CDC, and NIH. And I told them, I said, you're not going to like my message. This was actually back in about May. I said, are you sure you want to hear it? They said, yeah, Dr. McCullough, we want to hear it. And I presented a comprehensive review on vaccine safety and efficacy. And I pointed out that we had a signal with respect to excess mortality on January 22nd of this year. And I said, if we would have had a proper data safety monitoring board, which I do academically, I lead data safety monitoring boards right now for the National Institutes of Health. If we would have had the proper safety oversight, this vaccine program, which at that time was only for adults, would have been shut down in February for excess mortality before there were more lives lost. And then I showed the run-up. I said, we are now, and actually we sit here today, we have run up to 17,000 people who have lost their lives after the vaccine. About half of those are domestic inside the United States. They report into our VAERS system. 50% die within 48 hours, 80% die within a week. We have very good analyses from Rosa McLachlan showing 86% of the time there's no other cause of the death. I can tell you the application of these data to our children are going to translate. There will be children lost with the vaccines. There will be far more children lost with the vaccines than ever having the threat of COVID. For the children, we will look back and we'll say we were better off before the vaccines came in. COVID-19 has been a menace over our population, but largely for seniors. Seniors have suffered. Doctors in our circles have lost their family members. But people in the public has lost many family members. Now the menace over the public, and particularly over our children, is the vaccine. It is a vaccine. I was on Alex Jones yesterday. I don't know if you've ever seen him. He's a very explosive character. He's actually a lot of fun. I told him I've never shot a gun in my life. I'm not a hardcore right-winger at all. And he welcomed me into the studio, welcomed my wife. We had some great Texas barbecue afterwards. But I can tell, I told Alex Jones, I said, think about the virus and think about the vaccine. And with respect to this exposure to the spike protein and how the spike protein basically translates pathogenesis to the human body, in a sense, they are one and the same. They are, dose one is the pathogenic respiratory virus. The second doses, if people get them, are actually spike protein through the vaccine. So I agree with Dr. Alexander, and I agree with the premises that Dr. Malone has created. Childhood vaccination is off the table. Children will not have the ability at age 12 to make their own decisions regarding a potential fatal administration of an injectable product that you can't get out of their body. Do not let a child make a decision at that age. The World Health Organization yesterday announced that participation in school was the equivalent of assent for getting a vaccine. Historians will write on how distorted public health thinking is right now. Now, second part of what I want to talk about is natural immunity. I have told America over and over again, as a clinical doctor, that immunity after SARS-CoV-2, thank goodness, is robust, it's complete, and it's durable, it's long-lasting. SARS-CoV-2, the virus, is about 90% homologous to SARS-CoV-1. We've had SARS-1 17 years ago. The immunity has stood the test of time. The same is true with SARS-CoV-2. If it was possible to get COVID-19 a second time, really, I'm talking about severe infection, it would have happened hundreds of millions of times. Hundreds of millions. We wouldn't have missed the signal. We are still searching to try to find a real bona fide case of a second SARS-CoV-2. There's about 100 cases in the peer-reviewed literature. I've dug into them. I've emailed the authors. And every time it looks like there's confusion over a false positive test here or there. Early on, using the CDC methodology for the PCR, the CDC methodology, which was the laboratory-derived assays for all your hospital systems, including mine originally, could not distinguish between influenza and SARS-CoV-2. So it's very possible someone had influenza, they were misdiagnosed as COVID-19, and now a second time, 6 months later, in fact, they get the real thing. That's possible. It's very possible to get SARS-CoV-2 and get the real infection and then intermittently test positive for months afterwards. And I've had somebody in my family circle test positive 17 different times on and off after COVID-2. He didn't have COVID-19 17 times. He had it once. Please, in your mind, talk to your friends and family. It's one and done. My advice is, if you've had COVID-19, how many of you have had COVID-19? Let's see it. There you go. We've got half the people in the room. If you've had COVID-19, don't get another test. Please. All you're going to do is raise the, and you know what? You know what the CDC says for those who take the vaccine? The CDC says the same thing. If you've taken the vaccine, don't get another test. Now, that's not such good advice because, as I'll share with you, you can get COVID-19 certainly after the vaccine, but you can't with natural immunity. It's robust, complete, and durable. Paul Alexander has summarized 106 studies supporting that. You know, we need to get to the point and message this out. When your loved one is in the hospital with COVID-19 and they're sick and they're in isolation and they're desperate and alone, and you've recovered from COVID-19, demand your rights to go in as somebody fully immune and see your loved one. If you have a loved one who's in a senior home and nursing home and they've had COVID-19 and they've recovered, don't let them get subject to another lockdown, another episode of basically solitary confinement. They've had COVID-19. They've paid the price. They need their liberties. They need freedom from the mask. They need freedom to move about their facilities. It's wrong. It's wrong. And we got to step up. And we got to step up and start. Some of you work in healthcare. A lot of you do. Some of you are administration. Start to write some innovative policies in order to start to get our freedoms back. The pathway towards getting out of this is recognizing natural immunity. Think about this. If we don't recognize natural immunity and we propagate the false narrative that you can get COVID-19 over and over again, it's endless. Or you can get COVID-19 again, wear a mask. You can get COVID-19 again, take a vaccine, take another vaccine, take a booster. It can keep going. I had a patient of mine who's very afraid of COVID-19. She's had bypass surgery. She's had premature coronary disease. She's got a reason to believe that. Well, you know what? On her own accord, she took the vaccine. She took shot number 1 and 2 of Pfizer. She even snuck in a bit early to CVS and Walgreens, and they would do this. She got a booster before they're even approved. And I've had pharmacists confirm they were doing that. If people want a little extra juice, they can get it. Well, she got a booster. She felt better. She told me about it. She goes, Dr. McCullough, I even got a booster. I know I wasn't supposed to, but I'm so afraid of COVID-19. Well, she went on a trip. She went over to the Middle East on a trip. She's kind of a out there, very well-known newscaster, media person. Sure enough, she came back with full-blown COVID-19. And there we go. We're into our protocol again. And we did the full works, monoclonal antibodies, all the drugs in sequence. And she survives and she does great. And I saw her in the clinic on Thursday. And there she is surviving a COVID-19. I examined her, make sure there was no pericardial rub, make sure there was no signs of any lingering COVID infection in her body. And it's wonderful. It's a victory. And she looked me in the eyes and she goes, Dr. McCullough, should I take the booster? Another booster. And I'm telling you, I was on Alex Jones yesterday and I made the comment, I am getting deeply worried based on work done by Bruce Patterson, who has shown that in severe cases of COVID, the S1 segment of the spike protein is recoverable in human monocytes up to 15 months after the infection. It is conceivable that the spike protein, being an abnormal pathogenic protein in the body, particularly when it's dissociated from the virus with the vaccine, and Patterson, by personal communication, believes this is the case, that in fact, each injection of messenger RNA or adenoviral DNA and the weeks of spike protein production that occur afterwards, in a sense, shower the body with spike protein, and the body becomes loaded with this pathogenic protein. And then the body spends months clearing it out with monocytes and macrophages and tries to digest this and get out of the body. You can imagine right now, the current program in the United States is for an immunocompromised shot 1, a month later shot 2, a month later shot 3, 6 months later shot 4. With 4 shots, and each shot taking 15 months to get that stuff out of the body. I told Alex Jones in America yesterday on national TV, I don't think we'll ever get the spike protein out of the body. You don't have a chance to clear it out. And the probability that spike protein accumulation will progressively lead to disease, I think, becomes incredibly high. Disease along the lines of neurologic, cardiac, immunologic, chronic inflammatory syndromes, and hematologic. And we actually have new disease entities along that way. I think, honestly, I've been following my patients carefully. 70% of my patients took the vaccine in December, January, February. And like a good doctor, I didn't encourage them or discourage them. Remember, the vaccines are all research. They're all research. If I told a patient in one of my research studies, and I have a lot of them, that you have to be in my research study. In order for me to see you in my office, you have to be in my research study. Do you know what? I would be called on the carpet by the Institutional Review Board. I'd probably put up for FDA review. I would probably be incredibly penalized for that improper conduct. There is a code of conduct. It's called the Nuremberg Code. And that means under no conditions will a doctor ever put any pressure, coercion, or threat of reprisal for someone to either participate or not participate in research. So every single doctor, every single medical society, every single employer that has stepped over that line and told somebody that they should be involved in vaccine research or suffer some consequence has trampled over a fundamental of bioethics. And I can tell you what really ups the ante is that half of you have already had COVID-19. So you know, and Dr. Malone has shown you, there is no chance for you to benefit whatsoever There's not a single randomized trial showing a clinical benefit in someone who's recovered from COVID-19. In fact, people like you and me were excluded from randomized trials because the FDA and the manufacturers know you can't benefit. And there are 3 studies, Raw, Kramer, and Methodius, and 3 more that show excess harm. Dr. Malone has reviewed from them. And Jennifer Block's review in British Medical Journal is wonderful, with multiple expert opinions saying under no circumstances should those who are COVID recovered take the vaccine. In Block's paper, by the way, through May, using CDC and census data, she calculated 120 million Americans, like half of you in the audience, have already had COVID-19. You've already had the illness. That's before the Delta outbreak. You can imagine through Delta, we're probably getting close to 200 million Americans. It's over with. You've already had it. The war's over. No more masks. You don't have to worry about it anymore. That is a big chunk of America. So I'm telling you, this natural immunity and recognizing the natural immunity is the way to break the grip of fear. We no longer need to be fearful with respect to COVID-19. And please message that. Show your boldness. Show that you're not afraid. You know what I did? I made a few house calls. People in my circles, a couple of them, a very sick patient, someone in my religious circles, developed COVID-19. I knew they had the Delta. It's right in the middle of the summer. No one else is going to take care of them. You know what I did? I took my stethoscope. I went to their house. I went right into that air thick with the Delta virus. I had snot all over me, coughing. I finally made a couple of videos. I said, you might as well give me a kiss. I don't have a mask on. I had the Alpha variant last fall. You have Delta. I can't get it. And I went back 8 days later. And show the world you can't get it a second time. Just cough in my face. You can't get it a second time. We need that boldness. I advised Sri Lankan government. They got desperate. We were on some calls. Some of you are on the calls with me. They said, Dr. McCullough, we're running out of masks. We're running out of PPE. What do we do? I said, get your COVID recovered people out there. Man the stations that are handing out the treatment kits, and your COVID recovered people won't get the virus a second time. They said, is that true? Is that really going to hold? I said, do it. It's your only way to survive. Save your personal protective equipment for the hospitals. And they did it, and it worked, and they crushed their curve. So my final comments have to deal with medical therapy for COVID-19. It's very, very important. I think everybody in this audience realizes this has always been a treatable disease. Doctors, using their innovation from the very beginning, have always had the ingenuity and the innovation to treat disease. The CDC, the FDA, and the NIH are not treatment organizations. I'm a cardiologist. They don't provide a single recommendation for me to practice in cardiology, and they sure as heck don't provide a single recommendation for me to practice and treat COVID-19. That's not what they do. The treatment is beyond the range of those public health agencies. It's very important. Treatment is the domain of those in the audience and your doctors and your care providers. It's their privilege, it's their right, and there's their fiduciary duty to use all the drugs at their disposal to treat COVID-19. Please support them in this. And anyone in any position who attempts to block treatment of COVID-19 is participating in what, in my view, is immoral, unethical, and from a civil perspective, an illegal activity in blocking treatment to patients in need for COVID-19. Thank you.
Thank you, Dr. McCullough.